Apart from T1 and T2 weighted images, MRI also uses special sequences to highlight specific tissues, fluids, and disease processes. These special MRI sequences improve diagnostic accuracy and clinical decision-making. FLAIR stands for Fluid-Attenuated Inversion Recovery. It is a modified T2 weighted sequence in which free water signals are suppressed. Because cerebrospinal fluid appears dark, brain pathologies such as edema, tumors, infarcts, and demyelinating lesions become more visible. FLAIR is especially useful in brain imaging for detecting subtle abnormalities near ventricles. STIR stands for Short Tau Inversion Recovery. It is a fat suppression technique derived from a T1-based sequence. In STIR images, fat appears black while fat-related pathologies appear bright. This sequence is commonly used in musculoskeletal imaging to detect bone marrow edema, ligament injuries, and soft tissue inflammation. Contrast-enhanced MRI, also known as CE-MRI, is a T1 weighted sequence performed after administering gadolinium contrast. Gadolinium shortens both T1 and T2 relaxation times, but its effect is most prominent on T1 images. Areas with increased vascularity or breakdown of the blood-brain barrier appear bright, helping in tumor detection, infection evaluation, and assessment of inflammatory conditions. MRCP, or magnetic resonance cholangiopancreatography, is a heavily T2 weighted sequence. It highlights fluid-filled structures by making bile and pancreatic secretions appear bright. MRCP is mainly used to visualize the biliary tree and pancreatic ducts without the need for invasive procedures or contrast injection. Diffusion-Weighted Imaging, or DWI, is used to assess the random motion of water molecules within tissues. In many disease conditions, the movement of water molecules becomes restricted. These areas of restricted diffusion appear bright on DWI. This sequence is extremely important in early detection of acute infarcts, cerebrovascular accidents, stroke, paralysis, infections, and tumors. ADC, or apparent diffusion coefficient, is the opposite of DWI and is used to confirm true diffusion restriction. Areas that appear bright on DWI will appear dark on ADC in true restricted diffusion. ADC mapping helps differentiate real pathology from artifacts, especially in stroke evaluation. High B-value imaging, commonly referred to as B1000 imaging, is used as an additional confirmation within diffusion imaging. It improves sensitivity for detecting restricted diffusion and strengthens diagnostic confidence. Gradient echo imaging, also known as GRE, is sensitive to blood products and magnetic susceptibility effects. It is commonly used to detect hemorrhage, microbleeds, stroke-related changes, and vascular abnormalities. FIESTA is a high-resolution sequence used mainly for imaging cranial nerves and fluid-filled spaces. It provides excellent contrast between nerves and surrounding cerebrospinal fluid, making it useful for inner ear studies and cranial nerve evaluation. Time-of-flight angiography, or TOF, is a non-contrast MRI sequence used to visualize blood vessels. It relies on flowing blood to create bright vessel images and is commonly used to study arteries in the brain and neck without using contrast agents. In summary, special MRI sequences allow radiologists to tailor imaging based on the clinical question. Understanding these sequences is essential for accurate diagnosis, especially in neurological, musculoskeletal, and abdominal